Well, we're all getting ready for AHA 2012. I have my red dress tie on, and I've just seen Elliot Antman, the program chair, and Bob Harrington, who is co-chair. They have an amazing program, and I think the most late-breaking trials I think I've ever seen. It's really an astounding array of very important trials that will be headlined, I think, on Sunday with the Freedom trial. This, of course, is a comparison of CABG versus multivessel PCI in diabetics, a long-awaited trial Valentin Fuster and colleagues have been working on. So that will be a key trial for us to all pay attention to. The same day, there's a trial of chelation therapy. I hadn't really had that on my radar screen, but a big NIH-sponsored trial that'll be presented. Also interesting antiplatelet trial, the Arctic trial, looking at those non-responders to clopidogrel, how to manage them, whether to go to more intensive antiplatelet therapy, and that using some tailored therapy with antiplatelet testing. There are also a couple of fish oil trials, one to prevent AFib and actually two looking at AFib as a potential treatment there for postoperative and AFib in routine practice. On Monday, there'll be the Physicians Health Study 2 looking at a multivitamin to try and prevent cardiovascular events. We saw the very exciting data about 2-3 weeks ago on prevention of cancer with a simple multivitamin a day. And so it'll be very interesting to see the cardiovascular outcomes. In addition, there are a whole series of PCSK9 inhibitors, 3 different drugs with a lot of data and presentations to see these very potent subcutaneous LDL lowering drugs. In addition, the DAL outcomes trial will be presented. We heard that that was a negative study, but we'll see the results of this CETP inhibitor that raises HDL, dalcetrapib. Also interesting studies in heart failure, some looking at stem cells, a couple trials, one's Poseidon and a few others. Another Made It trial looking at differential programming to avoid inappropriate shocks and see if that could be help. And the Relax AHF1 trial looking at relaxin as a new therapy for acute heart failure. Then finally, on Wednesday, there'll be a presentation of mitral valve annuloplasty plus CABG versus CABG alone, another surgical trial that'll be very interesting. And finally, a trial called Reliable, looking at long-term treatment with 2 different doses of dabigatran. And so really an amazing array of trials, and this is not even all of them. I think there are 27, it may be a record-breaking number of late-breaking clinical trials. So stay tuned with us on the scene on Cardiosource and MedPage Today to get all of the trial results as they unfold. I'm Chris Cannon.